Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And a very important and common topic that comes up a lot is what non-surgical treatments can I do on my neck to improve the aging changes? No one likes their neck aging and everyone is looking for a non-surgical way to treat it. And I'm gonna go through my argument for why non-surgical treatments in general are a complete waste of time and worthless for treatment of the aging or sagging neck. But before we do, we're gonna break down, so you have a better context in understanding my argument, we're gonna break down what a young neck looks like. We're gonna look at what happens during the aging process and how those changes relate to the anatomy of the neck. And we're going to talk about how surgical approaches directly address those changes. And then we'll talk about where non-surgical treatments fail in their ability to address. So hopefully at the end of all that, it'll become very clear that surgical trumps non-surgical when it comes to the treatment of the aging neck. And with that information, hopefully it's going to save you lots of time, money, and heartache and disappointment as you endeavor going down this path. So without further ado, let's break it down. So the youthful neck. What does a youthful neck look like? We all know it when we see it, right? A beautiful profile contour, no laxity, firm skin, great jawline. At the tissue level, what you're seeing is there's a softness to the neck, and that's because it has a certain level of subcutaneous fat, but it doesn't have anything that's bulging or creating contour. There's also no laxity, there's no looseness in the neck. It's nice and firm, and it gives you that almost 90-degree angle when you look at it from the profile view. And on the front view, the jawline is V-shaped, there's no sagging centrally, all around. You know it when you see it. This is what we all want and what we want to recapture when it starts to loosen up and changing. Aging changes. What are the different types? Now there's several categories of aging changes. You've got the thin neck with loose muscle. This results in banding, this kind of central bands that come down like this that happen on both sides. Sometimes it creates a waddle down the middle. Sometimes you have two sides to it. All around the jawline starts to sink, there's jowling, and on the profile you have a loss of overall sharp contour as everything kind of droops downward. Another category is you've got those changes, but you also have volume starting to build up in the neck. You start to see fullness starting to develop underneath here. And that fullness is what gives the neck that heavy look as time goes on. And the combination of looseness and fullness is one of the more common changes that happen as a result of aging. Now, you could be younger and have fullness but no sagging, or you could be older and have no fullness but sagging, but you could, generally speaking, most commonly you have both. Now, why is that fundamentally important? Well, let's look at the anatomy. So when you look at the anatomy of a young neck, thin, superficial layer of fat underneath the skin, then you go one layer deeper, you've got muscle, then you go one layer deeper, there's a deep fat compartment that's generally speaking very thin. As you get a little bit older, the deep underlying fat layer starts to thicken and starts to get a little bit heavier. As you get a little bit older, that fat pad starts to get even more dominant and full, and as a result, it gets heavier and you lose more contour. Simultaneously, what's also happening is that the entire fascia of the face, which is connected to the platysma muscle in the neck, that starts to loosen. And as a result of that loosening, the neck starts to drift downward. This anatomic relationship is extremely important because many people don't realize that the neck muscle, the platysma muscle, actually interdigitates into the face, into the fascia of the face. So as the face starts to droop down, there's nothing holding the neck up anymore. So as a result, the face droops, the neck droops, and this is a very important point here because that is why I've always said you can't address the neck without addressing the face, because you gotta vertically reposition the face upward to take that muscle up with it so you get the right contour. However, there's deeper fat you have to deal with, and I'm gonna talk about that in a second. So let's talk about surgical. How do you address all these changes that are happening surgically? Well, I've already alluded to the loose muscle that's sagging, the platysma and the fascia, that has to be vertically repositioned upward. In my practice, I perform a technique called the vertical restore. You can get more information about it and see more before and afters in other videos and on my website. But what it does fundamentally is it takes the fascia and brings it up. But in addition, I make a small incision under here, and taking a look at this anatomic diagram, you see that there's multiple layers of fat, and the specific ones that are very important here are those deep fat layers. Because remember, I mentioned those deep fat layers are what increases the volume as time goes on. And surgically, the only way to get after that is to actually part the platysma muscle and get down to it and remove the excess deep submental fat. Once you remove that, then you've decompressed it, then you can reposition the muscle through a platysmoplasty where the muscle comes back together, you sew it back together, and then you lift it up, and then you get this beautiful contour that gets reestablished as everything goes upward. Now, a common mistake here is to think that that deep contour that's being caused, that fullness, is resulting from something that's happening in the superficial fat layer. That superficial fat layer is the layer where people do liposuction in. It's the layer that people do Kybella in. So now here's where it gets really messed up. You get this deep fat layer happening in the deep layers below the muscle. We know that sagging is part of the story. Somebody comes in and says, I have got a bright idea. I'm gonna do liposuction on your neck. I'm gonna do Kybella on your neck. I'm gonna do, radio frequency on your neck, whatever that you wanna do. Those just literally are treating the layer between your muscle and your skin. But guess what? That fat layer that's sitting above your muscle and between your muscle and your skin is extremely important in creating that supple, soft, beautiful, youthful neck. So you going in there and allowing somebody to liposuction that or using Kybella to remove that, you've actually just shot yourself in the foot. You've gone backwards. You've actually aged. That's never a good thing when it comes to this. You never want to touch that superficial layer. And I'm telling you, I open necks, as part of my vertical restore all day long. I almost never, ever remove the superficial fat layer. And guess what? It's like literally about this thick. It's very, very minimal in terms of its contribution. It's that deep stuff that's causing everything. So when you're talking about things that are effective, and it really, really behooves you to understand these anatomic relationships. So now let's talk about the non-surgical treatments and why their claims to improve the neck contour makes zero sense. Start with Botox, for example. Botox, is used for neck bands. Unless your neck is nice and tight and you're just having dynamic bands that flex when you talk and speak and eat, but your neck contour is really good and you're generally young, Botox in the neck isn't going to do anything. Okay? It just straight up won't do anything because it's not going to tighten laxity. It's going to decrease the contraction of that muscle, which is not resulting in sagging. Let's talk about radio frequency devices, Morpheus 8, all these different devices. There's a million of them out there. The microneedling devices or even the energy devices like Therapy, Thermage, and Profound, all these different things, they're putting energy, generally speaking, in the superficial layer. They're trying to touch the fascia by getting in there. But we just talked about this. Your muscle is sagging because the upward positioning of that muscle is no longer holding the neck up anymore. So you can't tighten it from below. You also can't use energy devices to decompress the neck and take out that deeper layer because they're not reaching it. Same thing with Kybella. Kybella can't even get down to that deeper layer, plus that fat is fibrous and it won't even allow it to work there. So that's why people get disappointed after Kybella. What about threads? Well, threads, you might temporarily lift up the muscle back up, and kind of tighten that muscular layer that we do surgically as well, but threads don't last. They all fall apart after several weeks to several months, and at the latest 6 months, and you're back to square one again, and you haven't addressed the deep fat layer. So it's interesting when you break all of this stuff down, it starts with understanding the anatomy and the aging changes. What about a neck lift alone? This is a good one. What about a neck lift alone? Well, neck lift alone is where you make an incision here and you go after this area. Well, neck lifts in general can be effective if you are old enough to see aging changes. And that could be in your 40s, it could be in your 50s, it could be in your 60s. But if you're starting to see laxity from above, and you think that going in here and doing something directly to the neck is going to fix the problem, you're going to be very, very dissatisfied, for lack of a better word. It's going to be a rude awakening, because the reality is once you tighten up here and this continues to come down, well, that neck will start to loosen up right away. I mean, you're not even gonna get much durability out of that area until you kind of lift everything up this way to hold it up from the top. And that's where you're gonna get your neck to hold up in the terms of the contour you want. So even a surgical neck lift alone is not gonna do the trick. So you're like, okay, well, what is gonna do the trick? Well, I've alluded to it several times, but I'll just make it super simple. You need an operation that's gonna go in here and remove fat if fat exists. You need an operation that's gonna tighten muscle and lift everything upward. That's where the vertical restore comes in. It addresses both the deep fat and the looseness all at the same time. It also elevates the midface, which is, again, when your things are falling, they're falling from the top down. It goes from the jawline to the midface to the lateral brow, all coming up together. So it actually holds everything up in a very sound and secure way, because if, again, same thing, if you lift this part up but this part starts to come down, you're gonna lose ground again and things are gonna come up. So you have to kind of take it all the way back up. And that's kind of one of the, I would say, the beautiful qualities of the vertical restore is how it takes everything back up. And I can't speak about every other type of facelifts. I will say that if I thought there was a better way of doing it, I would be doing that particular approach. And that's why I developed the vertical restore, trademarked it, etc. Because, you know, I strongly believe that it's the best way of doing this, but it doesn't mean that other surgeons can't do other great ways of doing it or whatever. That's up to you to discover. But for you to understand these nuances, put it all into context and put together the procedure that's right for you starts with this knowledge. So this is why non-surgical treatments and very minimally invasive surgical treatments will never get the job done when you're looking at real change in the neck, which fundamentally is something we all want. We all dislike, you know, the changes that happen in that area, and drives us to wanting to do these things. So I empathize with you, I understand where you're coming from, and that's why I've literally devoted my entire medical surgical career to addressing these changes, because I know how important it is. All right, guys, so that covers this topic. I hope it was helpful for you. If you have any questions whatsoever, drop them in the comments below. Videos to follow, we'll be talking about vertical restore, we'll be talking about minimally invasive treatments. Anything else you'd like to learn about, you'll find them in our playlists. We produce 1 to 2 videos just like this every single week. So if you haven't already, start subscribing, because there's a lot of good information which will keep you out of trouble, which will honestly save you a lot of headache and waste of money doing things that are ineffective. If you like this content, make sure you hit like and be sure to send it to some friends and family to help spread the word and help people become very knowledgeable and in control of their procedures. All right, everyone, thanks so much. Until next time, Dr. Amir Karam.